Hi, everybody. I'm international publicist Michelle Tennant Nicholson, and this is my pet project, How to Be a Precinct Leader.org. And as you know, I'm volunteering my time to help Henderson County Democrats actually get some key messaging out to the voters. And with me today, I'm so excited to interview and talk to Norm Bossert. Hey, Norm, how's it going this morning?
Oh, it's great. Glad to be awake.
Tell us a little bit about yourself and who you are in case somebody, I can't imagine somebody in Henderson County doesn't know who you are, but just in case there is somebody, tell us a little bit about yourself.
Well, I am running for state senate in the 48th district. It's the second time I've done that. I'm a retired school administrator and teacher. Had a 44-year career. Retired just a little while ago, about a year ago now. And I'm married to Shelley, who's just wonderful and sitting in the other room, probably wondering what we're talking about right now. And I have two sons, both grown. One served in the military for 12 years and is now a computer guru in Washington. He works at DARPA. And the other one is farming out in Joshua Tree, California, which is really interesting to me. It's mostly desert. I'm not quite sure how he manages to pull some of the things out of the ground he does. I've got 6 grandchildren. And I've been working at this campaign almost since the day I lost the last election. I started almost immediately and felt like we could do a lot better. I got 37,500 votes in the last election. And to me, that was a good start. So we're out trying to do what we can to repeat our performance last time. But we know from studying data, and this is good for your, for our precinct leadership to know. When we study data, we know how many people turn out for these off-year elections. If I were to repeat what I had last year, which would be wonderful, but if I could get the same number of votes from the same people, I would win this election handily. So we're very competitive. We know we're competitive. We've done polling, and the polling shows that we're competitive, and we're excited about the campaign.
Well,
so
and
that's a little bit about me and where we are.
I think this is wonderful, Norm. And so as we have conversations with our voters, do you want us to have conversations about the past election, or do you want us to focus on some type of campaign or issue? What's important that we lead with when somebody says, tell me about Norm, what's he all about? What should we lead with?
Well, I would lead with the education piece. I think education is one of our, according to our polling, education is probably at least the second biggest issue to people in the 48th Senate district. First issue is healthcare. I mean, we're hearing that over and over and over again. In fact, I had a lengthy conversation last night about that. But I would lead with my experience. I bring 44 years of experience into schooling and to my understanding of public education. And I think that especially with families, people with families, I think they're going to find that of the most interest. They want to know that somebody going to Raleigh will know how to spend their tax dollars on schools, which is, by the way, 60% of our state budget.
Yes, and I agree with you that healthcare and education, we had done with the party, we had done some branding and messaging work, which included polls of voters in the area, and then also polls of people at one of our luncheons earlier this year. And that was consistent as well. Those were the main issues. And there was also a concern about gerrymandering. But let's go back to education. So what about education should we be talking about? What is the most important thing that you would work for regarding education? I mean, as an administrator, you can tell all of us, what we should be looking for to change.
Well, there's so much that we need to change right now. It's I sort of break it up into a teacher set of issues and kid set of issues, and they're both really tied together. But to start off with, the kids are the most important part, and any teacher would tell you that. As much as teachers would like to be making a lot more money, their first concern is meeting the needs of their students. I know that from talking to lots of teachers this past year. So let me say this. The first issue is we need to put more money back into our kids. We are funding them at the same level, actually at a lower level than we did just before the recession in 2008. $500 less per pupil right now. So the first big issue is fully funding our schools. We need to be sure that we have money going into our classrooms so that the teachers have the supplies the kids need. I mean, everything from Band-Aids to books. And they need those things every single day of the week, and they're not getting them right now. The books are a particularly interesting situation. At my school at Black Mountain Elementary, we were using history books that had been copyrighted in 2001. And I don't know about anybody listening to this, but most people I know think that something has happened in our country since 2001.
Yes, for sure.
So
2001.
Something's
Those are
happened.
old
I don't
textbooks.
know what, but something's happened. And so we want to be really certain that we put money back in the kids' hands. Our teachers need more than just more pay. They also need the tools they need to do their job. But in terms of their career interests, our state has taken away career status from our teachers. Career status means most people would interpret that to be tenure. It's not the same thing, but it's close to it. It's protection against egregious firings and guarantees of due process for teachers. That's gone. We no longer pay teachers for their advanced degrees. Well, I think that's a mistake too. The only way a teacher can get paid for an advanced degree is if their particular job requires a master's degree. But in the meantime, our teachers aren't doing that. In terms of encouragement for career status for any teacher or a career for teachers, we need to know that they've done away with longevity pay for teachers. Used to be you got an incentive for continuing your career beyond 20 and 25 years. Now they've taken that incentive away. In addition to that, they've taken away the incentive for staying beyond 15 years by pretty much shutting down pay raises for teachers who are senior. So there's not a lot of incentive for people to stay in the profession. So that's another thing that we need to be focused on. How do we get good teachers, and how to retain them? And those are some of the issues that I see as real important right now.
Great. I would agree. I'm actually one of those teachers who left the teaching profession because of I could make more money in the private sector. So I first know firsthand like why that's not something that when you want to actually have. And I loved teaching. I taught fifth grade, and I really had to look at my student loan debt and what would pay off the student loan debt. So these are issues at my own heart. Thank you so much for standing up for them. What about healthcare, Norm? What do you want us to say about healthcare and what you would do around healthcare? Because that's really, people just want, when we pulled them, an issue of safety kept coming up, right? So not only safety, like your physical safety, but like I'm safe because I have health care. If I get hurt, I'm safe. Or my home is safe. My community is safe. My job is safe. So that was a pretty big thing. And of course, the teachers want to be safe. So it's not only how we're actually controlling guns in our community or, like in my precinct, the aspect of gun ownership is very important, but also healthcare. And when I go to the hospital, are my bills going to be met, or can I even make my monthly payment on my healthcare? Those kinds of things. So any of those things that you want us to kind of pierce in and talk about with voters. They do talk about it, by the way. On Sunday we canvassed here in East Flat Rock, and we had a 20-minute long conversation with a young couple who is really struggling with healthcare because one of the spouses got sick. And so this is definitely something that's affecting our voters.
Well, first of all, I canvassed in East Flat Rock as well, not with you, but about a month ago. And
thank you so much. I appreciate you doing that.
Well, we're getting around quite a bit. And matter of fact, just completely unrelated to your question, we've been out canvassing for close to 3 months now. And we have just increased our canvas time to twice a week. And we were doing once a week just on the weekends. And now we're up to twice a week. And probably in a couple of weeks, we'll up that to 3 times a week. We're getting, when we canvass, we try to go to places where we think a lot of people don't go visit. So we visit sometimes neighborhoods that are struggling. And we did that in East Flat Rock when we were there. A lot of the families we visited were living in single wides, and many of them in pretty poor condition. So it was a real eye-opener for our team, first of all, to see the poverty that some people are living with right in East Flat Rock.
Oh,
Right
for
now, we're
sure.
next door
Oh,
neighbors.
for sure. Yeah,
Yeah,
we had some diverse neighborhoods that we hit on Sunday, and some of the neighborhoods I've been here since 2002. I used to live in Saluda, and it is an eye opener for sure. How some of the
yeah.
neighborhoods are living.
But,
Yes.
and then coming back to those neighborhoods, Michelle, what we learned also is that one of their biggest concerns is healthcare. Many of the people we spoke to had no healthcare. They couldn't afford it. And so the affordable care was not affordable for them because mostly our federal government has done away with subsidies. So the first thing that needs to happen is we need to immediately expand Medicaid. That would take care of close to 500,000 people who are making less than, I think, $10,700 a year, which is pretty meager financial support for a family. But if we expanded Medicaid, they would be able to have care. But I have a bigger vision than that. I don't think that's good enough. I think we need to look statewide at a single payer option. We need to get out of the health insurance business and get into the health care business. And by so doing, if we had a single payer option, it would be so good for business, first of all. And that's a big concern to conservative thinkers. What impact will doing something like this have on business? It would relieve our business owners of the responsibility of providing health insurance for people. It would get them out of the health insurance business. It would save them tons of money. And that money would be better spent, I think, someplace else in promoting their business or giving their employees better pay. So I'd like to see a single payer option. If I could wave my magic wand, it would be Medicare for all. But I don't have a lot of faith in our federal government right now to put Medicare for all in place anytime in the near future. Other states are experimenting with and looking into single payer option. I refer back to Pennsylvania. So I got to hear two people from Pennsylvania, a Republican and a Democrat, talking about a bipartisan bill to do exactly that in Pennsylvania. Pennsylvania can do it. We can. I've been to Pennsylvania. We are just as smart as the Pennsylvanians are. I can assure you of that. And if they know that that's something they can do, we can do it also. So single payer option and Medicaid expansion immediately.
Let's say that I have a voter and they've never heard the term single payer option. How would you help a precinct leader talk about, hey, we need to move from health insurance to health care, and one solution would be the single payer option?
Mm-hmm.
What's the elevator speech on what that is, Norm?
Single payer option, just as an elevator speech, that usually means less than 3 seconds. I don't think I can be that fast.
30 seconds.
30 seconds.
30 to 45 seconds.
30.
You can do it.
I can do it. Okay. Single payer option means basically that an employer would contribute a percentage to your health care, and you would contribute as an employee a percentage to your health care. Pennsylvania is looking at 10% for employers and 3% for employees. Now, what makes that, I think I may have just made a mistake. I think it's 13% for employers and 3% for employees, which is, by the way, less than they're contributing right now for health care for everybody, health insurance and things like that. It's a much better rate for our businesses, so they're charging less. It means that we're not getting socialized medicine, which scares people sometimes. We're actually paying for our insurance. Now, we would keep Medicaid expansion in place if we needed to, because we still would have people who are unemployed who still need health care. So we would want that to remain in place for at least the immediate future. The first thing that needs to happen, though, Michelle, is we need an impact study in North Carolina. We want to be sure that if we go into a single payer option, we know how it's going to affect the economy of our state. I believe that'll have a very positive impact. Yeah. I also think in a more important sense, it'll have a positive impact on people's actual health. Does that help a little bit?
It is. I just want to, there's a story that I know of and I'm not going to mention any names because you all will probably know who this business owner is. He has a small business in Henderson County, and our traditional healthcare system, one of the employees' husbands got severely ill, and then all of the rates spiked for everybody. I'm just looking at the, the opposite opinion about healthcare. And what happened is he had to then not offer healthcare to any of his staff because it would have closed his doors. And he had a medical, well, let's just say that he has a medical business, okay, himself.
Mm-hmm.
So what happened is his wife, so he had to get rid of health insurance for everybody because they couldn't afford it at the whole company. And then the wife had to actually go teach because even though she didn't have a teaching degree, she could get on as a teacher's aide and then would have health insurance for the family through the educational system. So, and then this family, by the way, is Republican, right? So I want to point out that particular example so you've got a very successful businessman who can't afford health care for his staff because one person got ill. And then the stay-at-home mom has to then go work because we have to get into some type of socialized situation. It's not really social medicine, but it's some type of system where everybody is able to actually have that. So I'm really for anything that makes sense. And for me, the more I learn about single payer options, it just makes sense. And I love the fact that you're thinking about studies, because that's the other thing is that, while Pennsylvania may be doing something like that, it may make more sense for us to do something else here in North Carolina. And I like those conversations. So as we bring the video to a close, and what I'm left with, Norm, is when we're having conversation about who Norm Bossert is inside our precincts. One of the biggest things is education, and then there's healthcare. Is there anything else that we should be bringing up with voters after we first listen to see what their issues are? Because I think it's important to understand where voters are coming from and then speak to whatever their issues are first. But what could we bring up that you're passionate about? What else?
I'm also passionate about people making a living wage in our little piece of the world here. We have very nearly full employment right now in the United States and even in Western North Carolina. Problem is that people are working at low-paying jobs, and those low-paying jobs make it impossible for them to live without government assistance. Here in the mountains, one of the things I've learned living here and as a school principal, it's a lot of mountain pride. People don't like taking handouts from the government. They don't want to. They want to take care of themselves. We haven't had an increase in the minimum wage, I think in at least since 2008 or 2009. And our communities are not even permitted to pay above or to establish their own minimum wage above the state level here in North Carolina. The General Assembly has taken that away from them. So my concern here is that we pay people for what they do. They need to get paid enough to put a roof over their head. They need to get paid well enough so that they can afford health care. They need all of those things. They need to have their pride back. So instead of working 25 or 30 hours a week at 2 or 3 different jobs, they need a full-time job, just like I had for so many years. And they need to have the pride and the ability and the pride restored to them to take care of their families themselves without having to ask for help.
I one of the things that I was just thinking about the mountain pride that you're talking about, and I want to just put it out there. You may already be really busy in your schedule, but we are going to canvass on October 8th. In the evening. So we've been doing the weekends, but we're going to try some evening time slots. That's a Monday night. So you're more than welcome to go with us if you like. And I really appreciate your time this morning. And I do think that this is going to make a difference for the precinct leaders to really understand, okay, here's how we have conversations about Norm. I want you to know that I have your sign in my front yard.
Thank you.
Yeah. And so if you like what Norm is saying, go ahead and put your sign out in his front yard. You get the sign from headquarters.
I've only got 1,500 of those signs. So that's a good start. One is good. Now we have 1,499 more to go.
Awesome. Awesome. Is there anything that you want to say about particular precincts that are pivotal for you before we end? Because I know that this is going to be reaching a an internet audience could be anybody watching this, including, high Republicans if you're watching this checking out Norm. But I also want to know, like, is there something that you want to say specific to certain precincts?
Well, I will tell you that in Henderson County, all the precincts are important, obviously, but we have precinct 2, which is a pretty large precinct, which we ought to be able to win. We didn't in the last election. We lost it by 7 votes. 7 votes. I mean, that's a hiccup and two knocks on 2 doors, and that's about all it would take to win that precinct. But we should be able to win Hendersonville pretty handily. And so all the precincts in Hendersonville are real key. That's one of the biggest places for population. We need to get out to Brickton and to Fletcher. Brickton is not an organized precinct. We are going to be out there, I think, tomorrow afternoon, as a matter of fact, canvassing in Brickton. It's, like I said, it's not organized, but it's got a lot of Democrats living there. So we want to try and get to them as much as possible. Fletcher, big gathering of Democrats in Fletcher. So we need to get to Fletcher as well and really knock on those doors and introduce ourselves to the people there. Rod Whitesides did a great job there. Mills River is an encouraging area because Brian Caskey won there as a Democrat and a seat on city council. It's a vulnerable district that we think we can tap into. And then Flat Rock. Flat Rock's a tough part of town, but East Flat Rock is really a precinct area, an area where we believe we can really appeal to a lot of the voters there. And we believe we can get them out to vote. And that's the key to success, was we need to get them to make a commitment to vote.
Yeah, and the conversations that we've been having, because we do have a disparate income level so you've got people who are very wealthy, they might be retired, next to some very poor working families.
Yes.
And I think that the issue really is getting them alternatives to voting on the day of, right? So early voting or absentee ballot, and explaining to them how easy that is to really help them. Because I'm having conversations and there, when we were doing some phone canvassing here in East Flat Rock, I reached a lady who was in Atlanta. She goes, "Oh, I don't know that I can actually vote because I work so much." And that's when I suggested absentee ballot, and she was like, "Oh, that's perfect." So just making sure that people have options to actually fit their life, and their life can be demanding for sure. So thanks so much for all you're doing, Norm. You've got my support.
Well, thank you, Michelle. I appreciate your support. I appreciate that you got your sign out. That's really good.
Yay!
We're out to win this election. We think this is doable. Our polling tells us that we are within reach of winning this election. We need as many people out there as possible. And just for the heck of it, as long as I've got you here, let me put in a plug for an event we're having on the 20th of September.
Okay.
It's a free for people who want to attend. 20th of September, T.C. Robertson High School from 5:30 to 7, a Unite for Education event. Not just for teachers. We want anybody who loves our public schools to come on out, wear red for ed, and come on out to support our teachers, our schools, and public education here in North Carolina. We have Queen Atkinson coming as our guest speaker. She's the former state superintendent of schools here in North Carolina, and she knows her stuff. So she's a great person to bring.
So that is Thursday night, if you all are available for that and you have an open calendar. So September 20th, 5:30 to 7. And I would imagine that this event is also put up at our Democratic website, Norm.
I certainly hope so. I know that we've sent it to them. I haven't checked the website to see if it's there yet. But hopefully it's there.
So the other thing is I don't know if people know, but an easy way to remember our website for people is beonegoodapple.org. It stems back from the luncheon that we had earlier this year that recognizes people doing community work in our area. So let me just take a look at, and by the way, everybody, Norm, your website and all the candidates' website are at the myhcdp.com, which is hard to remember. So if you just remember beonegoodapple.org, that's easy for people to remember. So we've got all on the right-hand side, we have all of the candidates and their websites and what's happening. And then if you look into what's happening, there's a ton of flyers that are available. And I'm looking to see about that 20th one, just to give you immediate feedback. So yeah, you might want to, so we've got, so you might want to get that sent again, Norm, have somebody on your team. I'm not sending, I'm not seeing it. The 16th, the 6th, we've got the 15th, something going on, and then the 13th, and then the 12th. So it would have been between the October and the September one. So sure. I would send that again, because I know that they're committed to actually getting that up, and there's people trained who can get that up quickly for you. So, well, I appreciate your time this morning. Thank you so much for meeting with me, and you've got my vote, and I will do my best in East Flat Rock to get others to vote for you.
Thank you very much, Michelle. I appreciate your time. You have a good day.
You too.